Hey, I'm Dr. Josh, and I'm sitting here with Lauren. She's a sports medicine provider here at Performance Clinics, and bringing you today some really cool stuff that we are doing with athletes in the arena of performance enhancements. So we do a lot of work with sports medicine, physical medicine, rehabilitation, reconditioning, and we have a really awesome tool that we use, which is low-level laser therapy, and Lauren administers the laser therapy with a lot of the athletes, especially for injury healing and reconditioning. But how we're using this protocol now in performance enhancement is actually quite cool. And really what it does is it serves that missing link to neurocognitive enhancement. So, you know, anybody can run, anybody can jump, change directions, get bigger, stronger, faster, but where we're focusing this attention is in the neurologic output of the body. So sensory feedback, brain gets that information and gives an efferent or a motor output. So we're using this in two rings for performance enhancement to start. Call it the tracking athlete, right?
Yep. And
the running athlete, because almost every athlete is on their feet doing something. So we're going to do a quick demonstration today of how the neurocognition works, the neuroenhancement works with the laser therapy for a tracking athlete. So Lauren, would you explain just a little bit on who this is for as far as a tracking athlete and when you would use this type of protocol on a tracking athlete?
Yeah, absolutely. So if an athlete, typically it's going to be a baseball player, softball player, tennis player, even soccer players, anybody who has to make direct contact with a ball with either their foot or a bat or a racket.
Yeah.
This is really kind of where we can zone in and focus in to enhance their performance as far as tracking goes.
Now, when is the best time to use this type of protocol
on
an athlete?
Typically, the day of your game is going to be most efficient. So coming in, you know, in the morning before game day is going to be most efficient, but we can also do it the day before as well.
Okay, cool. Explain your process of evaluation, like what you would go through to assess an athlete and how you initially would use this, and then we'll give a demonstration.
Yeah, absolutely. So usually what I'll do is we'll go through some just simple manual muscle testing. So testing your strength, so how's your flexion, how's your extension in your arms, in your wrist, and then shoulder flexion as well, just to see where the strength lies. If we notice any weaknesses, we're actually going to target the brain to help strengthen that area. So the neurons can go ahead and connect from your brain to that area of weakness.
Basically, you're recalibrating the muscle, right? You're
exactly.
just engaging that muscle in a very, very quick manner, right?
Right. And then as far as the tracking goes, as you'll see in the demonstration here shortly, we're going to be just using simple eye movements with the laser to help zone in and target in those intricate muscles, so you can get a little bit more accuracy on your hits.
Rock on. So when a batter is slumping, maybe a golfer isn't hitting as correctly, and we're talking about fine-tuned athletes.
Fine-tuned athletes, yep.
Cool. So, all right. Well, we're gonna show a demonstration on this. I'm gonna be Lauren's guinea pig, and so we're gonna give you a little insights into what this laser therapy, this modern, contemporary, really cool performance enhancement hacks, if you will, are doing for athletes to enhance or their performance or even get out of their slumps. So, cool. Here we go.
So first, like I mentioned before, we're gonna go through just some simple manual muscle testing just to see where your strength is at. So go ahead and make a fist right here, elbow tucked in. Don't let me push you down towards the table. Good, nice and strong. Don't let me pull you up. Good, nice and strong. And I test both sides. Okay, so we'll go this side as well. Don't let me push you down. Good, don't let me pull you up. Good, all right, and then I'm gonna have you go on this side, arm straight up in the air. Right here.
In front?
Yep, right in front. Don't let me push you down. Good, nice and strong. Don't let me push you up. Awesome. Same thing on the other side. I'm gonna push you down. Don't let me push you up.
Okay.
Good, nice and
so
strong.
just for representation purposes, if you find an athlete that actually breaks, what would you do at this particular point?
At that particular point, what we would do is laser your brain while we're holding that position.
Okay.
So that's going to allow the neurons to kind of go and connect.
And that's the recalibration. So we're going to get a very
recalibration.
accurate understanding on how we're using the laser to dial in the focus here.
Absolutely.
Right, cool.
So he passed. He passed all his tests, nice and strong. So we're going to go into some simple eye movement and tracking. So what I'm going to do is laser on his brain, and he's just going to kind of follow my finger as we go through. So get this going here. Follow my eye here.
You want me to keep my head straight?
Keep your head straight.
Okay.
Yep. Just using the eye movements. Good. So I'm just going to go through one round. Typically at this point, I'll check in with the athlete, make sure they're not feeling dizzy, not having any off symptoms. You feeling okay after doing that?
Yeah.
Okay.
Oh, yeah.
So the next step then, right, so we're athletes, so we typically aren't using our eyes all over the place following a finger, but we have an object that we have to keep our eye on. So we're going to pretend he's a tennis player. I have a tennis ball. So what I'm going to do here is we'll get the laser going. We're going to have the tennis ball off in the distance. So this is as if the ball was going to be coming in at you. And what I'm going to have you do is stare at the ball at the distance.
Okay.
And now go ahead and turn your head. Keep your eye on the ball.
Okay.
Turn your head to the left. Good. Back to center. Turn your head to the right. Back to center. Good. Look up. Keep your eye on the ball. Back down. And then look down. Keep your eye on the ball. Good. So just one round through there. Typically, I'd probably go for about 30 seconds to a minute on that. I can't turn this off. There we go. So with this, coming in game day, should really help enhance the moment of strike, the moment of hit, to improve accuracy in your striking and in your hitting.
Yeah. All right. Awesome demonstration on that. You know, the laser sometimes looks too good to be true. Is that all there is to it? How does that tune in an athlete? But for all intents and purposes, we won't talk about the physiology and the science of the laser and bringing it out of just the rehabilitation ring and into this performance enhancement, but it is that technologically advanced that it will tune in your nervous system to do
what it needs to do.
Yeah. So in another video, we'll check in on the running aspects of tuning in for runners, for athletes that are doing a lot of plyometric work, power athletes, and you can see how we tune gait in and get people out of running patterns that are not good.
Right, exactly.
All right. Thanks for tuning in. We'll talk to you soon.
Have a good one.